na. Doc Ayan, so let's start.
Yes.
Hello, Doc. Okay, so good evening, everyone. So welcome to our Dalubhayop Technical Tech Talk series. So this is our 11th episode. Tama ba ka, Doc Ayan? So we're going to talk about mites of dogs and cats and how are we going to treat it using the Fluralaner. Okay. So to start with, I'd like to call myself. So I'm going to lead the prayer, to formally start our tech talk. So let us place ourselves in the presence of God. Almighty God, our Father, we praise and thank you for this night. We come to you asking for your blessing and help as we gather together virtually. Please bless our speakers for this night's tech talk, that that may be your instrument in order for us to find the passion to excel in our chosen profession. We pray for guidance in the matters at hand, and may you bestow your blessings after this tech talk, so that we may go out and practice what we learned in the spirit of love and enthusiasm. May we realize that this activity should be glorify your name. We ask this in the name of the Lord Jesus Christ. Amen. So again, good evening and welcome to our 11th episode of the Dalubhayop Technical Talk. Now, to welcome our participants and introduce who Dalubhayop is, I would like to call Dr. Resty Borja to please welcome our participants and again introduce Dalubhayop. Doc Resty, please.
Yes. Thank you, Dr. Carla. To our distinguished guest speakers, fellow veterinarians, both in government and private, students of veterinary medicine from different universities and colleges, friends of Dalubhayop, isang mapagpalang gabi sa ating lahat. I am Dr. Orestes Borja, graduate of veterinary medicine from La Salle Araneta University, a retired military officer and forces of the Philippines Veterinary Corps, and a member of Dalubhayop. This evening, once again, in behalf of Dalubhayop, I am pleased to welcome you to today's session, webinar, or Dalubhayop Tech Talk on mites and Fluralaner treatment in dogs and cats. Once more, this is a motivating topic for discussion because we all know that mite infestation is a common health problems among dogs and cats. Thank you for joining us and spending your precious time with us today. I am very confident that we will find new understanding or insights into the topic after the seminar or webinar. For those of you who just joining us today, again, welcome. I wish you all, everyone, a successful session, webinar this evening. At this juncture, allow me to introduce our association, Dalubhayop. Dalubhayop stands for Samahan ng mga Dalubhasa sa Palagumutang Hayop ng Palawan. Dalubhayop is an association of licensed veterinarian in Palawan and presently based at Puerto Princesa City. It was organized and founded last 1994 with 9 pioneering members headed by late Dr. Jerry Ortega. The goals of the association is to work with the welfare, unity, protect the rights and interests of all members, and promote the professional development of veterinary profession in the province of Palawan. At present, the association is represented by more or less 25 licensed veterinarians. Dalubhayop is an affiliate member of Philippine Veterinary Medical Association. Once again, magandang gabi sa ating lahat.
Thank you very much, Doc Westy. So before we proceed with the presentation and introduction of the speaker, I would like to remind our participants or attendees to please kindly mute your microphone, no, unless you are acknowledged to speak up. And if you have questions at nahihiya kayo na magsalita, you can use our chat box. Then we will read the question during our Q&A. So right after the presentation. And if you want to speak up, gusto nyo talagang itanong yung question, no, you can raise your hand. So i-reserve nyo muna yung question nyo sa ating Q&A portion. Now I would like to call Dr. Ian Hagmis to introduce our speaker for this night's Tech Talk. Doc Ian.
Hello, good evening. Na-surprise naman ako. So,
Kala mo, ikaw lang marunong mag-surprise. Ako din.
so tonight, our meeting is co-sponsored by MSD, and we have 3 doctors from MSD tonight. First is Dr. Lani Acero. I'm sure kilala nyo na siya at na-meet na natin siya. Madilim, Doc. So, nakapagbigay na po siya ng talk niya dati. Siguro mga 3 years ago, no, Doc? And then we have someone from MSD rin, Dr. Poan Boyser. Doc Poan. There. Araw sa kanila. Gabi na, Doc, dito sa amin. And our speaker for this evening is Dr. Bianca Arejola. Doc Bianca.
Hi, Doc. Good evening.
The Technical and Marketing Manager of the Companion Animal Business Unit of MSD Animal Health. Doc Bianca is also known as Doc Binky, correct?
Yes, Doc. Yes.
And then she's a graduate of UPLB, correct?
Yes, Doc, correct.
Pero hindi ko alam kung anong year. So tonight she will present, and I let her introduce herself more. Doc Binky, you have the floor.
Thank you, Doc Ian. Good evening po to everyone. My name is Bianca Arejola. You can call me Binky na lang po. That's my nickname. First of all, I would like to thank you, lahat po ng nag-attend yun on behalf of MSD, Doc Lani and Doc Poan. I know it's a very busy, it has been a very busy day. I'm sure kung galing din po kayo ng clinics. And so we really appreciate the invite for having us here tonight. Hopefully marami po tayong matutunan from the topic tonight. Just a short background, as mentioned ni Doc Ian, I am a graduate of UPLB. I graduated in 2013. Actually, classmate ko po si Doc Migs. So, hi Doc Migs. Salamat. Thank you for attending tonight.
Hi, Binky.
Hi Migs. Kamusta?
Ayos naman. Masaya sa Palawan. Sige, tuloy mo na yan.
Thank you. And so it's very nice to meet everyone. I know these are special circumstances, but hopefully kahit na ganito po ang ating setup na hindi tayo makapag face-to-face, meron pa rin tayong matututunan, something that you can also use in your practice. Okay, so let me just share my screen po. And I'll be turning off my camera while I am presenting kasi medyo mahina po ang aming internet dito sa Laguna. Baka mag-drop ang aking call kapag naka-on ang camera while presenting. Okay, so if you have any questions po regarding the presentation, as mentioned by Doc Carla, we will have a Q&A after the presentation. Good evening, everyone. My name is Bianca Arijola. I am the Technical and Marketing Manager for Companion Animal Business Unit here at MSD Animal Health. So tonight we will be discussing about mites and Fluralaner as a treatment in dogs and cats. So to start our presentation for today, uh, for those that are not familiar with MSD or MSD Animal Health, please allow me a couple of minutes to actually share a bit of background on who we are as a company. Normally kasi, from our experience, Brevecto is more popular in clinics versus when we say that we're coming from MSD. So we want to share a little bit more about our company. So MSD is mainly a pharmaceutical company, and we aspire to be the premier research intensive biopharmaceutical company in the world. We've been around for about 130 years, and we bring medicines and vaccines both for humans and animals. As of today, we strive to be at the forefront to prevent economically important diseases that threaten both people and animals. As of last year, just to give you an idea, we are comprised of around 74,000 employees, and we've invested around 13.6 billion in research efforts in 2020 and allocated 3.1 billion for humanitarian efforts worldwide. This comprises not only for humans but for animals as well. So locally, we've existed since 1996 with three main business units. So that's swine, poultry, and companion animals. Also, as a bit of trivia, a little bit of trivia, MSD was actually a product of a merger between two companies. These two companies are Sharing Plow and Intervet. So later, when I show you our product portfolio, you'll see that there are some brands that would be coming from Sharing and then some from Intervet. Okay, so we decided to actually keep some of the products coming from these two original companies. So for companion animal business, let me just share one slide about all of the products that we are actually offering. In case you are interested in any of our products that we won't be discussing today, just let me or your sales representative know so that we can discuss this with you in further detail. Okay, so for our products, it's actually split into three categories. We have our biologicals or the vaccines. We have two different lines, the Nobivac and the Quantum line. So the main reason why we have two brands is because one is coming from Intervet, which is Nobivac, and Quantum comes from the Sharing Plow line. So if you want more details on the different vaccines that we offer, just let us know. We can set a specific date or a seminar for this one. For parasiticides, of course, the one we'll be tackling today is Brevecto. We also have Scalibor, which is an anti-tick and flea collar. That's also water repellent. We also have Imizole, which is an injectable. It's a treatment against Ehrlichia and babesiosis. For pharmaceuticals, we have our veterinary preparation of insulin for dogs and cats, which is Caninsulin, and Vasotop, a flavored chewable tablet for dogs with congestive heart failure. Okay, so now moving on. First, we'll discuss what exactly is Fluralaner. It's the active ingredient in Brevecto, which we'll be focusing on our discussion for this evening. So Fluralaner, it's the active ingredient within Brevecto. It provides fast, easy, and lasting protection. Okay, so it's a very innovative molecule, and to date, there has been no known insect or tick resistance to this molecule. It's readily absorbed into the bloodstream from the skin for the spot-on preparations and through the gut for the chewable preparation. So Fluralaner works safely and systemically inside the animal and provides total protection for up to 12 weeks. It's the only tick and flea and mite treatment available in both a chewable and spot-on preparation. Okay, and also another thing to note with this molecule, it's the only confirmation under isoxazolines that has a preparation that's available for both cats and dogs. The others in the market under isoxazolines only have a preparation for dogs. Okay, so moving on to mites, our specific discussion for tonight. So the most common mites that are actually present here in the Philippines are Sarcoptes, Otodectes, and Timotex canis. So it's often called mange. So mite infestation is often called mange. There are new indications. Actually, we updated our indications from, I think, early 2020 or late 2019 to include the three different types of mites for both our preparations of chewable and spot on. Because initially, when we introduced spot on into the market here in the Philippines, we didn't have the claims for mites, and most of the clients were actually asking, parang, do you have ear mite claim, especially for cats? So, good news, we have it for all of our different preparations, both for dogs and cats. So first, we're going to tackle otodectes cyanotis or ear mites in cats. And as you can see in the video clip, this is very typical. Uh, have any of you encountered, diba, cats that are suspected with ear mites? Normally, they have very dark brown cerumen in the ears. So if you'd like a copy of the video clip, something that you can use in detailing in your clinics or to share in your social media pages for your clients, just let let us know so we can send you a copy of the file. So for ear mites in cats, this is something that is very common. It's a common occurrence in cats, especially stray cats. And it's less common in dogs, although sometimes we do get a lot of cases with dogs with ear mites, and it's far less common, but can also happen in rabbits. So in this slide, just a short refresher on our parasitology, just the basic life cycle of an ear mite. So it completes its life cycle in around 15 days or more from the egg to the adult. So for ear mites in cats or otoacariosis, um, most cases of otitis externa that happen in cats are actually caused, around 50% of these are caused by ear mites. We know that this is a very highly contagious condition, and it is commonly characterized by signs such as head shaking, ear scratching. We would see inflammation and pain, specifically in the ears. And there are cases that there might be um, trauma, as you can see in the photo on the left side. And The debris in the ears are normally characterized by the coffee ground appearance of the debris. So we have a published study on the use of Fluralaner against Otodecta cyanotis infestations in both dogs and cats. So I will discuss first the one for cats. So basically what we did was we used 16 or employed 16 cats in the study. These cats were divided into two groups. One that was treated with Brevecto spot on and another which is the placebo, and they used saline. And then they counted the number of mites through otoscopic means and did a debris score on the different time points, which is 7, 14, and 28. And they did a bilateral ear flush under sedation and live mite count on day 28. So if you wish to have a copy of the published study, just let us know. We can send it to you via email. So for cats, as you can see in this table, um, we can see that there was actually a visible decrease in um, the number of mites seen under otoscopic examination on day 14 and 28. So there were no mites. Actually, it was 100% eradication of mites on day 14 and 28. So it took 2 weeks to completely eliminate all of the mites. And in the placebo, where saline was used, mites were still visible up until day 28 after treatment. So for cerumen or debris that were observed, there was a reduction in the severity of the debris that were observed in the cats for those that were treated with Fluralaner versus the ones that received the placebo. As can be seen in the graph for day 14 and 28. Okay, so the results basically, as you can see in the table, mite count was reduced by 100%, 100% eliminated on days 14 and 28 after treatment. And this protection actually lasts until 12 weeks or around 84 to 90 days. All treated cats had improvement in cerumen exudation or the debris compared with pre-treatment and versus the placebo, which is saline. So in addition to that, a separate study, an independent study was actually also done in Europe where they used stray and client-owned cats in Italy. These cats were naturally infested with ear mites. And apart from that, they were also determined to have fleas. They were treated with Brevecto spot on for using the recommended dose. And they observed these cats. They did otoscopic examination as well to determine if at several different time points, if ear mites and also the fleas would still be present. So from day 7 up to day 84, which actually represents the 12 weeks. So treated cats lived in close contact with the untreated and infested cats during the trial. So they weren't separated from each other. So the summary of the results for this study is first, a single topical dose of Fluralaner completely eliminated the fleas and ear mites in cats with mixed natural infection by these two ectoparasites, Tenoscephalides felis and Otodectes cyanotis. It showed 100% efficacy against both of these ectoparasites up until 84 days or 12 weeks after the treatment. Second point was that no fleas or mites were found 7 days after the treatment. Then the third one is that complete control of both infestations lasted until the end of the study, day 84, which is actually the first time this has been shown for both species together, which makes Fluralaner a very valuable product for keeping cats free of infestations. So Fluralaner or Brevetto provides a very easy, fast, and convenient way to treat ear mites in cats using just one dose. So it has a high efficacy against ear mites as demonstrated in the previous studies that we discussed. Just with one dose, you can eliminate these ectoparasites and you just need to monitor constantly, re-examine 28 days later. It's very convenient and it improves the compliance of pet owners to the treatment regimen. It has a very strong safety profile and it offers not just treatment for mites but also flea and tick protection. And because it lasts for 3 months, it protects against fleas. For 3 months, it actually breaks the flea life cycle, hence the additional claim of preventing tapeworms. Of course, if a cat is already or has an existing infestation of tapeworms, this is not addressed by the product. There should still be regular deworming for the cat. So now, moving on to dogs. A similar study, like the one we discussed for cats, was done for dogs. Dog ear mite challenge was also conducted. It's actually together in the same study, the first study that I presented for cats. So in this case, they studied 24 mixed breed dogs and they split these dogs into three categories. So 8 of the dogs were given chewable Brevecto, the other 8 with spot on, and 8 with a placebo, which is also saline. And they counted the number of mites and they scored the debris on different time points, which are 7, 14, and 28 days. And bilateral ear flush under sedation and live mite count on day 28 was performed. So in this slide, you will see the results of the study when comparing Fluralaner, that's a chewable form, the spot on, and the control, or the ones that were given saline solution. And you can see that for Fluralaner in the chewable and the spot on, there was a significant decrease in the number of mites that were present during when they did the otoscopic examination. And by day 28, 100% of the mites were already eliminated. So for the cerumen and debris that were seen, there was also a significant decrease in the severity of the debris found for those treated with the chewable and the spot-on solution. So to summarize the study, the mean mite count actually decreased by 99.8 at 28 days after the treatment, regardless if it was using chewable or spot on. Because we actually have the same claims. Locally, we have the same claims for chewable and spot on. Later, in some of my latter slides, we'll be discussing some of the differences between the two, or how do we position since they both have the same claims. And second point, based on the study, the cerumen exudation or the debris, the coffee ground appearance that you can see normally with animals that have ear mite infestation, it improved overall in the dogs that were treated with Brevecto. So next one we'll be discussing about Sarcoptes or Sarcoptic mange. So scabies mange mites caused by Sarcoptes camyevarcanis. These are skin burrowing mites As you might have seen in the previous slide in the short video clip, these are highly contagious and zoonotic, uh, meaning it's transferable to humans, and it might be hard or it's quite difficult to actually find these mites in scrapings versus demodex. And it has a worldwide distribution. So I'm not sure how many of the practitioners that we have here in our seminar tonight have actually encountered uh, scabies mange mites. In my experience, I've only handled one case of scabies. So it's not as common versus Demodex. So for the life cycle, this is just to demonstrate how long it takes from the point of the eggs being laid when they burrow into the tunnels up to the point that they become adults. So roughly it takes around 1 to 2 months in total for the parasite to actually complete its entire life cycle. And this is very critical uh, when determining your treatment option for this type of mite. Okay? Because um, the compliance of the pet owners are or is actually a big factor in the treatment plan. So for sarcoptic mange, the common clinical signs that we encounter is that there's pruritus, skin redness, hair loss, and in some cases, for prolonged infections, there also might be secondary infections, usually bacterial, or it can also be fungal. So a study was also done to assess how Bravecto or Fluralaner fares in cases of dogs that are diagnosed with sarcoptic mange. So in this study, they did they observed 16 dogs that were naturally infected. So they were able to diagnose 16 dogs with sarcoptic mange. And they split this into three groups. A group that was given chewables, uh, one with spot on, and another with a control, which is saline or a placebo. And mite counts and lesion scores were done on day 0 and 28. Okay, so the result of this study showed that there was a 100% reduction in the mite count by day 28. And there was an improvement in clinical signs at 4 weeks. So because the mites are already reduced, so the signs also waned down in terms of pruritus, papules, casts, and crusts. And hair regrowth was also observed in all of the treated dogs for those that were given chew and spot on. So to highlight, uh, basically it requires only one dose of Bravecto or Fluralaner to eliminate mange mites effectively. So it has a very high efficacy against sarcoptic mange versus some of the other preparations in the market under isoxazoline. Because based on my research, I found some studies indicating that for these other products, you would actually need to do two dosings for to completely eliminate the mites. So this is a more convenient and cost-effective way to treat and address mange. Okay, so it has a long treatment interval, correlating this to the life cycle that I showed earlier. For Sarcoptes, it takes around 1 to 2 months for the parasite to complete its life cycle. So if you're taking a monthly or you're using a monthly treatment, if the pet owner is not compliant with taking the dose every month, there's a risk that there still might be some the mites might still be present if they don't take the second dose. There could be another flare up. So if they take Bravecto, it's just one dose and it covers up to 3 months. It's way longer than the life cycle of the parasite. So it effectively breaks the life cycle of the parasite as well. So it's a convenient way to ensure compliance in the pet owners. So it's a more effective treatment regimen because they just have to think about it once, and has a very strong safety profile. Because as I mentioned in my first slide, Fluralaner has been found to be safe for breeding pregnant and lactating dogs. So it has a very, very strong safety profile. So in conclusion, for sarcoptic mange, just one dose of Brevecto, regardless if you're using the chewable or the spot on, it is an effective treatment against sarcoptic mange infestation. So if the pet owners are not comfortable with using the chewable, or they don't like giving oral medications, or it's quite difficult to give to their pets, they can always opt for the spot on instead. So we have a very flexible program to still improve and ensure the compliance of pet owners, so that ultimately the treatment plan uh, will be effective. Okay, so now moving on to Demodex canis. So for demodectic mange, this is a hair follicle mite. It's non-contagious. It's present worldwide, and it can be found in most normal dogs. So dogs that are usually immunocompromised would be the ones that would manifest more severe clinical condition. So it is actually the most common Demodex mite in dogs. So for the disease signs, we have two types of demodicosis. So the localized one, wherein we only find around 4 lesions, wherein the diameter of each lesion would not exceed 2.5 centimeters. And then we have generalized demodicosis, wherein there are greater than 4 lesions found, and with a bigger diameter, bigger than 2.5. And also, the feet are affected as shown in the photo on the right. So common findings would be hair loss, red skin, scabs, and infection could a secondary infection could also be present. So based on age and immune status, as I mentioned in the first few slides for this segment, immunity plays a role on how severe the disease can be. So for juvenile onset, this occurs usually in dogs that are less than 18 months old. They are immunocompromised. The possible reasons could be there could be endoparasitism or malnutrition or other underlying causes. And second one is adult onset, wherein the dog is greater or older than 18 months. Uh, Again, immunosuppressed. There could be use of chemotherapeutic drugs or glucocorticoids, and the dog could also be immunocompromised, which could be caused by several different factors, as stated in the examples. And there was a study that was conducted wherein they found that around 56% of dogs could possibly have no underlying cause when they are diagnosed with dermatitis. So in this slide, just a review on the life cycle of Demodex canis. Basically, it takes around 20 to 35 days to complete its entire life cycle. This is critical because, as mentioned in the previous discussion for Sarcoptes, it's necessary for when a pet is taking the monthly treatment, it's necessary that the compliance is very good, since if the life cycle exceeds the 30 days or 28 to 30 days, they might require an additional dose. So if they miss that second dose, there's a probability that there's a recurrence of the infection. So that's why the life cycle is also a critical factor to consider. Okay, so for Brevecto 2, a study was also conducted for demodicosis. So they found 60 naturally infested dogs, and they separated these dogs into two different treatment categories. In this study, they used chewable versus another uh, ectoparasiticide that was available in the market. The component or the active ingredient of this product was imidacloprid and moxidectin combination. So mites were counted and the lesions were scored on several time points. Day 0, day of treatment, 28 days, 56, and 84. So based on this study, they found that by day 28 or after 1 month of treatment, around 99.8 of the parasites were eliminated with Fluralaner. For the other product, for imidacloprid and moxidectin, around 98% uh, reduction was seen at 28 days. But when you look at day 56 and day 84, there's actually a decrease in the efficacy for imidacloprid and moxidectin. Versus with Fluralaner, it actually increased, and there's a significant difference between the two products. I believe the one that we have available in the PH market is, I think, monthly for imidacloprid and moxidectin combination. That's probably why it's uh, the efficacy is decreasing as the duration of the study progressed. Okay, so Fluralaner offers one dose convenient treatment for the frustration of Demodex. So we know naman based on yung mga previous treatment regimens available way back, even when I was a student, when we didn't even have isoxazolines yet in the market, or it wasn't even included in the modules in pharmacology. So we used different treatment regimens, and it could be quite frustrating to manage Demodex. But with Fluralaner and Brevecto available in the market, you just need one dose. It's highly effective against demodicosis. It offers a long treatment interval, which also improves compliance because, as we discussed in the previous slides, the life cycle of Demodex could be from 20 to 35 days. So if you're just using a monthly and the pet owners are not compliant, there's a risk of um, recurrence of uh, demodicosis. So Brevecto also offers a systemic effect and residual efficacy lasting for 12 weeks or 3 months. And although Demodex mites remain in treated healthy dogs, they do not cause severe disease or manifestation. There are no lesions that can be observed. And as mentioned in the other slides, it has a strong safety profile and offers convenient compliance, peace of mind also for the pet owners. They just have to give one dose every quarter. And it offers flea and tick protection. Also, for Brevecto in dogs, we also have prevention of blood parasites. Okay, so it eliminates demodicosis in dogs with just one dose, regardless if you're using our chewable or the spot on. So in this slide, we just wanted to share a local real life success story that we've had with one of our clients with Brevecto spot on treatment. So this dog was actually diagnosed with uh, generalized demodicosis, as you can see in the photo in day 0, very severe. And even the body condition score of the dog was very poor. And since it's still the dog is still ongoing treatment, we only have up until day 30 as of now. So we're still waiting for the photos for the second and third month. So there is actually a very significant difference from day 0 to day 30, an overall improvement in the condition of the skin and the body condition. So similar to the studies that were conducted internationally, Brevecto, as seen in this in these photos, is very effective in managing and treating canine demodicosis. So if you do have similar cases, please do let us know. We have several limited slots that we offer a similar program wherein we require photo documentation. Just coordinate with your MSD Animal Health sales representative so that we can collaborate and share the success story so that we can also help you, our vet partners, future vets, uh, to show pet owners that, this disease, though it's frustrating, can be managed, can be effectively managed. Okay, so now moving on to the positioning for spot on. One of the very common questions that we receive is that, Dok, bakit ba may spot on pa? If parehas naman sila ng claims with the chewable, how do we determine which one to use? So, outlined in this slide are the reasons why or how do we position spot on. Diba? Why is it necessary to have these two available in our market? So first one, there are owners and also vets that would prefer spot on for administration versus the chewable. For cats, of course, it's quite difficult to do oral medications. Administration of oral medications can be stressful for cats, hence the spot on preparation. Then third, there are some dogs that are sensitive to oral treatment. They might be vomiting. If they're going to the clinic and mahiluhin pala sa biyahe, may tendency to vomit when they get home. So if you gave Brevecto chewable at the clinic, pagdating sa bahay, nahilo, nagsuka, or during yung transit from clinic back to the house. So sayang yung gamot. And a way to go around this is to use the spot on instead. Okay? And it also has a stronger treatment window for ticks. And for dogs that are recovering from anesthesia or under sedation, dogs and cats actually. For example, a dog went in for an elective surgery and you observe that during recovery, this dog actually had ticks or may fleas. So we know that for ticks, they can cause blood parasites. Uh, we can immediately provide treatment through the use of Brevecto Spot On. We don't have to wait for the dog to actually recover, have his or her first meal before we give the chewable. So you can immediately provide treatment with the Spot On. Okay? And last one is pet parents who would prefer to give a Spot On for dogs that are, for example, on a feeding trial. So you want to eliminate all of the other possible factors that could be causing an allergic reaction. If the dog is on a special diet and you don't want to interfere with that um, nutrition plan, so a spot on is a very effective alternative solution so that you don't compromise uh, preventing ticks and fleas and possibly mange. Okay, and also dogs that are at risk for transient gastrointestinal upsets or are picky eaters. And also, I was not able to include it in this slide, but dogs that have a tendency to bite, also, we can't give the chewable to them. So, kung nakabusal siya sa loob ng clinic, we can provide or administer the spot on instead. So, at least safe pa rin po yung vets and the staff that will be handling the dog. Okay? So, in conclusion, for Brevecto and mites, treatment for ear mites and cats can be done with just one dose. There's just a need to re-examine after 28 days just to observe if there has been any recurrence or if there's any additional treatment that might be required. But based on the study, after 28 days, the ear mites have been 100% eliminated. And one dose is a convenient treatment option for managing demodicosis in dogs. And it eliminates mange or scabies mites on dogs with also just one dose. You don't have to give it every month. Okay, so it provides a safe, fast, easy, and long-lasting protection for both dogs and cats. Okay, so in this slide, this is just a summary of the safety and the claims that we have for Bravecto for dogs. Uh, the things that I just want to highlight with this slide is that for dogs, puppies have to be at least 8 weeks of age and should weigh 2 kilograms before we can administer Bravecto, chewable or the spot on. Okay, and as I mentioned in my previous slides, it has a strong safety profile. So even up to five times of the regular dose is it's still proven to be safe for dogs. So I don't think naman po naabot tayo ng 5 times accidentally mabigay. But in case there are some instances that pet owners might ask, Dok, nabigay ko ulit. 'Di ba 3 months dapat parang nakailang weeks pa lang or 1 month pa lang nabigyan ulit. So that's safe. They don't have to worry because up to 5 times it's proven safe. Okay? And then for cats, uh, the requirement is kittens have to be at least 9 weeks of age and they have to weigh at least 1 thing to note as well with the spot-on preparations for dogs and cats. Dapat po walang paligo 3 days prior to application and then upon application 3 days din siyang walang paligo. Okay? So before we go to our Q&A, before I end my presentation, I would just like to request everyone, if you could please support us online. We have several pages on social media. For Facebook, we have two. One is Brevecto Philippines, which is for dogs, and Brevecto Cats PH for cats. The goal of these pages is to encourage pet owners uh, to get their pets checked, to become responsible pet owners, why it's necessary to give preventatives, especially for ticks, fleas, for mites, because we know that uh, especially for ticks, they can transmit blood parasites as well. So the goal of the page is to direct the pet owners to our partner vets and to educate them of the importance of preventatives. And for Instagram, we also have our social media page, which is brevecto.ph, and our website, brevecto.com.ph. Apart from that, we also launched just this year the We Are Family website. This website is all about responsible pet ownership, owning pets, that pets are not just dogs and cats that we leave at home. They are part of the family and it's necessary to give them the proper care. So we have a lot of different articles here that are free to use for our vet partners. These are reference articles for pet owners. Some of the topics that we discuss on this page are how to properly take care of your pets, what are the core vaccines here in the Philippines that they need to have their dogs and cats brought to the vet to have their shots, uh, when they want to adopt a new pet or have a new pet at home, what are the necessary things that they need to prepare for, what are the toxic foods that they should avoid for their dogs and cats. So these are not branded um, articles or not branded discussions. These are generic discussions for pet owners to know the basic information that they need to know. So we created this website not just for the pet owners, but for you, our vet partners and future vets as well, so that we can help you uh, spread the information so that pet owners appreciate why what we're doing in our community, in the veterinary community, to take care of their pets better. Okay, so this website is absolutely free. So please feel free to scan the QR code, visit the website, and browse the articles that we have here. Hopefully, there's something that you can use. If you have your own social media page, you can freely reshare any of the content. Okay, so this is my last slide. Thank you for listening. Hopefully, you were able to absorb something useful that you can carry into practice. If you do have any questions or clarifications, the floor is open for any questions. If you would like a more specific in-depth discussion about Brevecto or the other products that we have under MSD, just let us know. You can contact your MSD Animal Health Sales representative so that you can set a one-on-one meeting or a webinar with you, and we can address any of your concerns or if you have any inquiries. So thank you, and enjoy the rest of your evening.
So thank you, Doc Bianca. Okay, so everyone, our floor is now open for questions. So if you have questions, you may raise your hands. So kung gusto nyo talagang to speak up, then kung nahiya kayo, we have our chat box. So meron bang question? Sige, while waiting, no, kung may, baka nag-ano pa sila ng tanong. Doc, nagkaroon na ba kayo ng study if there is a possibility na magkaroon ng resistance yung mites against Fluralaner?
So far po, Doc, wala po. It's a very new molecule kasi as of now, wala pa siyang 10 years in the market. So no reported resistance pa po in mites as of now. But of course, in the future, hindi naman natin talaga 100% assured. That's why we want to make sure din na we educate din the pet owners na dapat yung compliance nila kung kailan dapat binibigay, di ba? With any medication, even, di ba, with antibiotics, dapat responsible tayo when using so that we avoid yun, yung possibility of resistance. So,
kasi ang
same
problema sa mga pet owners, lalo yung mga Pinoy, napapansin ko, magpapavet sila, then pag nakita na observe nila na effective yung bigay ng vet, katulad yan sa treatment, pag kita ng effective siya, hindi na yung babalik sa vet, tapos bibili na sila. So paulit-ulit nilang, so yun ang problema, kaya minsan nagkakaroon ng resistance kasi yun at yun lang nang bibilihin nila kasi alam nilang effective siya. But meron na ba kayong at least a recommended na parang treatment program for mites para lang ma-prevent yung possible na resistance?
Actually, Doc, it's the same po. Preventative tsaka yung treatment namin. It's every 3 months po. So it's the same. Wala silang kailangang baguhin kung let's say may na-diagnose na merong might problem versus kung gusto mo lang mag-protect for ticks and fleas, it's the same po. Kaya yung na-mention ko kanina regarding peace of mind, same lang yung pag-treat ng ano. So dapat po they're compliant with the 3 months. Hindi tayo lalagpas doon or meron din kasi kaming na-encounter na questions na parang hindi ba pwedeng hatiin na lang namin yung bigger dosage kasi marami daw pong aso. Syempre yung ganun, we highly discourage that kasi syempre number one, hindi natin alam kung tama ba or equal yung dosage na nabibigay dun sa iba-ibang aso kasi weight-based po siya. So doon pa lang, 'di ba, misuse na po 'yan ng ating medication. Pwedeng later on it could possibly cause, hindi natin alam, 'di ba, na dahil nga hindi tama yung dosage baka magkaroon ng resistance. That's why we need to be vigilant din in discussing yung client education sa ating clients na dapat tama yung dosage and regular yung pagbigay. Yun.
Okay, thank you, Doc. So any questions pa? Doc Ian? Yes, Doc Ian.
Yes, Doc.
Yes, Doc.
Ay, Doc. Ay, nakamute pa po, Doc.
Ako, teka lang. Ang usual hesitation ng may-ari ng mga pet owners kasi kaka-Google nila. Pag i-Google mo kasi yan, una-una lalabas yung mga side effects, mga neurologic signs. Dito sa Pilipinas, na-document nyo ba yon?
So far, Doc, wala pa naman po kaming na ano. Pero it's in the claims, yes. Pero same with other drugs, di ba po, kahit yung sa tao, we record everything, all of the possible side effects. So it's a medication, di ba? Each and every person or each and every pet that takes a drug, hindi natin talaga 100% ma-assure ko ano yung magiging effect nila doon. So we educate them na ano. But for Bravecto, we do have studies to show the safety. If you would like a copy of those studies, we can also provide that. It's safe, and as I mentioned in the previous slides, we have a claim na it's safe na pwede rin po siya for breeding, pregnant, and lactating na dogs.
Actually, hindi naman yung vet yung nag-hesitate, kundi yung owner. I've used the product pero may kaka-Google nga nila minsan nasusobrahan sa kaka-Google. Kaya siguro ganun. The next question is about yung tablet form. Is it preferred to be given with a meal or ibigay lang siya anytime? With a meal or anytime?
Better. Recommended namin, Doc, with a meal na ano po. Especially kasi minsan, di ba, doon natin na-discover baka yung aso kung first time, baka may gastrointestinal upsets pala siya, maselan siya sa food or sa medication. So, we recommend na with a meal po siya binibigay.
Thank you. Yung teka, nalimutan ko yung itatanong ko. Yung pagbibigay ng, sabi mo kanina may dalawang options, either spot on or chew.
Chewable.
Let, oo. So, anong difference nun?
In terms of preparation lang, Doc, pero sa claims parehas po sila. Yung length ng efficacy niya parehas po silang 3 months or 12 weeks. Yun lang yung way ng pag-administer. So yung isa yun po, oral siya, the chewable. Yung spot on, pinapatak sa nape area. So we have the two different preparations. Depende na po sa preference ng vet at saka ng pet owner saan sila mas comfortable. Kasi we don't want to sacrifice naman na kung may hesitation sila with using a chewable or mahirap talaga magbigay ng chewable for that particular pet, at least they have the option to do the spot on pa rin. Po.
Doc, regarding this chewable, ano ba itatanong ka? Pwede ba na, halimbawa hindi available yung spot on, then yung chewable lang talaga yung available sa market, halimbawa dito sa Palawan, just in case lang, no? Pwede bang ihalo siya sa food?
Yung chewable, Doc?
Oo, lalo na kung nahihirapan yung owner. Wala naman choice kasi walang spot on. Hindi
Yes.
available na. So, okay lang ba ihalo siya sa food?
Yes, Doc. No problem po na isama sa food. Actually, yung ibang dogs, open hand, tinatanggap nila yon. Na although alam naman natin merong ibang aso talagang maselan po, di ba? Alam nila kapag yung gamot, minsan pamimilian. So, i-educate lang din si pet owner to make sure na hindi pipiliin or hindi iwanan kasi syempre sayang din na yun po.
Ang usual palang reklamo ng may-ari ng yung mga pet owners. Bakit daw nagbigay na ng Bravecto? Bakit nakakakita pa rin sila ng fees at saka ng fix?
Ang isang possibility nun, Doc, is, di ba, yung sa life cycle naman po ng ticks and fleas, not all of them are on the dog or on the cat all the time, di ba po, may time na they're pwedeng nasa sahig, yung mga cracks and crevices sa bahay or sa grass, pwedeng meron pa pong natitira doon or mataas talaga yung infestation in the area. So, di ba, from that time, pwedeng aakyat, babalik sila doon sa dog. So, ang kailangan po is kumagat muna siya para yung mga galing po sa external environment, di ba, makakuha din sila ng Fluralaner para ma-eliminate sila. So, yun po yung mga possibilities. Or we also have to check din the history of the pets. Baka merong, for example, kung may fleas pa, baka may stray cats around na constantly reintroducing the fleas into the environment. Yun po.
So may question, Doc, sa chat box natin. So ito yung question. Would there be an overdosage if you give Bravecto once a month or every 2 months?
It's safe po hanggang 5 times na maibigay yung Bravecto. But of course, we would not recommend po na kasi syempre sayang din sa budget na But in terms of overdose, wala po. Kasi hanggang 5 times, unless na lang you give it kasi kung every 2 months, that's kung every 2 months, di dapat magdodoble siya. So safe pa rin po siya. The only exception po pala doon, sorry, I forgot to mention, is kung yung puppy, very small, tapos di ba kung bigger breeds, rapid yung kanilang pag-grow, so yung body weight niya nag-iiba na. So usually kapag ganun po yung instance, after 2 months, pwede na tayo magbigay ulit. Kasi yung proportion nung body weight ng aso versus the dosage that was given originally, magkaiba na po.
Share ko lang.
Sorry. Oh, yes.
Natawa
Yes,
ako.
no.
Naalala ko yung sa COVID vaccine. Di ba sabi may microchip daw?
Oo nga. Kaya yung iba ayaw magpabakuna.
Oo. Yung Bravecto wala namang microchip.
Wala naman, Doc.
Doc, meron pang isa. Kasi naano ko doon sa presentation mo. Pwede siya 'di ba ibigay is 8 weeks old na sa dogs, then 9 weeks, tama ba? 9 weeks old sa cats.
Cat,
So,
yes.
paano kung naibigay siya sa younger? Any effects?
Wala naman, Doc.
Wala naman.
Okay, pero yan lang po kasi yung weight band natin, of course. Kaya po tayo may recommendation ng And of course, yun din po syempre, that would be extra label kung mabigay siya ng earlier or underweight.
Okay. So, any more questions? Yes, Ayan. Naka-raise pa rin ng hand.
Sige pa rin naka-raise hand ako. How about yung use ng Bravecto together with other products? Together with other products, would you recommend the use of that medicine together with ibang mga, halimbawa yung mga collar,
Dewormer or
yung collar or other forms ng
medication, Doc?
No?
So far, Doc, wala naman po siyang contraindications. It can be used with other preventatives. We also have a collar, yung aming water repellent collar, yung sa dogs ko mismo. Even Doc Lani can attest to this na sinasabay namin yung collar namin, si Excalibur with Bravecto, and of course yung regular deworming ng mga aso every quarter din po yun, diba? So pwede silang wag lang po syempre sabay na ibibigay mo together na at least merong konting interval. But yung isasama nyo siya sa program together, wala naman pong problem.
Can they be given on the same day? Kasi Bravecto ay Fluralaner, di ba? For example,
yes,
may medication pa for ibang like heartworm preventative. Okay lang?
Wala naman siyang, yes po. May
baby.
Okay daw.
Apo. Ayun, we don't recommend po na sabay. Wala silang conflict na, kumbaga walang contraindication. Pero ang concern po kasi doon, let's say, sensitive pala siya doon sa isa pang gamot na isasabay natin doon. Baka nagkaroon ng gastric irritation, na isuka, may susuka sabay. So, syempre, sayang naman po yung gamot na So, we recommend na separately. Huwag sabay po pagbigay.
Doc Ayan, may question pa? Any more questions? sa ating
Ay,
mga...
si Doc Pat. Ay, akala ko naka-raise yung hand ni Doc Patty.
Oh, naka-raise. Pwede magtanong.
Nag-clap siya.
Hindi, pwede magtanong. Okay? Oh, pasok ba yung sound? Yes?
Yes,
Yan.
Doc.
Yes, Doc Pat, we can hear you. Do you have
Oo.
question, Doc Pat?
Binibigay natin yung every 3 months. Saan tumatambay itong Bravecto meds sa katawan kaya siya tagal? Like, kunyari, isang kakompetensya nyo every once a month lang. Yung mode of action is parang, di ba, neurotoxic siya for the
Yes, Doc.
parasite. Yung pangalawang
Yes.
question ko, how sure are you that it's not neurotoxic to the animals if it is neurotoxic to the parasite? So first is, how come matagal siya sa system? Saan tambay yung Bravecto or yung kanyang, yung nakakalito eh. Yung kanyang gamot sa system ng aso.
To answer your first question, Doc, meron siyang binding in the plasma proteins, kaya po matagal yung kanyang duration. So parang slow release po siya. It's a neurotoxic, selective neurotoxicity siya to the parasites. It binds on sa GABA receptors. Kaya po siya hindi nagiging toxic sa dogs is because after the 3 months na i-eliminate po siya through the feces. Around 96.3% of Fluralaner is actually excreted in the feces after the 3 months po. So hindi siya na-absorb nung katawan ng dog after nung 3 months na yun, na-excrete pa rin po. Na-address ko po ba, Doc, yung questions?
Okay lang. Kasi merong review kasi nung nakaraan sa Google. Tama si Doc Ian eh. Si Dr. Becker of
Yes.
sa US. Ewan ko kung nakita niyo na yun about yung ibang mga patients or yung ibang mga dogs nagkaroon ng reaction, neurotoxicity. How do you react to that?
For us in Bravecto for Fluralaner po, it's very safe. We've issued a statement regarding that. Actually, the one that Dr. Karen Becker was discussing, yung sa FDA na announcement na yun po, I think that was in 2019. Kasi yun nga po, as I mentioned earlier, for FDA, di ba, sa claims, even for yung mga medicines natin sa tao, di ba, makikita natin pag tinignan mo yung adverse reactions, adverse events, you will see a lot of different reactions because we record lahat ng possible na side effects even for human medications po, 'di ba? But for us in Bravecto, it's very safe. We've actually distributed more than 100, I think 150 million doses as of late last year in over 80 countries in worldwide po. So it's very safe. Yun lang po talaga syempre with FDA na nag-release sila ng ganong statement. Talagang we understand na magkakaroon talaga ng concern with vets and with pet owners. Even 'di ba kahit sa atin sa sarili natin with vaccines, 'di ba? We're concerned what are the things that we are putting in our body. So we're here to help din naman po to help the vets and the pet owners understand the safety profile of our product kasi ultimately we want what's best din po for you, our partners, and for pet owners.
Okay na Doc Pat?
Thank you, Doc.
Yeah.
Pwedeng pa-recap naman ng nung kasi yung product for cat is essentially the same as the product for dog. Wala silang
It's the same molecule, Doc, pero in terms of the concentration of Fluralaner, it varies po for cats and for dogs. So that's why we have a separate preparation na yung spot on meron tayong specific for dogs, meron tayong for cats.
Okay, so any questions pa po?
Ano species, ano yung mas malakas sa pusa ba o sa aso? Kung iba?
Same sila ng effect, Doc. Yun lang pong concentration, magkaiba sila ng ano po.
Ano yung concentration sa cat? Is it greater than the dogs or baliktad? in concentration?
I have to check, Doc. Di ko lang po memorize. Pero I believe mas mataas yung sa dogs for the spot on.
Okay, so any more questions? Mukhang tahimik na. Doc Ayan, mention mo kanina yung raffle. May raffle ka daw.
Hindi. Announce ko muna next week ang topic natin.
Okay.
Oo, June 15 na ba next week? June 15, 2 p.m. It is about anesthesia.
Honestly,
Yeah.
with Doc Jill.
Yeah, alternatives ng ng Solitil. He will discuss yung multimodal approach sa pain management at saka other medicines na pwedeng gamitin.
So next week, huwag kakalimutan po. 2 p.m. Okay. Kuya Ayan, yung paraffle mo.
Di ako magpaparaffle, si Poan.
Oh, sino ba? Okay, Doc Poan. Akala ko ikaw eh.
Hello, good evening.
Good evening, Doc.
Ayan, Doc, madilim na sa likod ko. Ayan, gabi na talaga. So, meron po akong prepare actually na quiz. And gusto niyo ba ng game or raffle na lang yung gawin natin? Kasi kung quiz, yung pabilisan tayo ng sagot through the chat box. Ganun na gagawin natin. Pero kung raffle, nakalagay na ako dun, yung mga names ng nag-attend, nakalagay na dun sa aking wheel of names para i-raffle na lang natin.
Para pantay.
Paraffle na lang daw.
Okay, sige po. So,
Opo, kasi mahirap mag...
okay. Pero siguro before I start yung raffle, present ko lang po siguro yung list ng mga contact numbers just in case you want to avail of our products, ang MSD products. You can either contact me o kaya i-share ko lang po yung contact numbers ng mga distributors po para lang familiar po kayo dun sa yan. Ito na lang siya. Ayan. So can you see it po ngayon? Ayan. So
Yes.
yung partner distributors po namin for Palawan, we have EVR, Infinity, at saka Perfecto. So pwede niyo pong picturean or screenshot yung ating screen ngayon. Si Sir Alex Hardin for EVR, si Sir Harold Vergara for Infinity, at si Sir Eric Villaroman for Perfecto. Sila po yung naka-assign doon sa Palawan area ng mga distributors na yan. And kung may mga questions naman po kayo, pwede nyo akong kontakin directly. Ito po yung email address ko, flori.and.wizard@merck.com, or you can contact me through my cellphone number at 0917-838-4169. Ayan. So, ready na kayo sa raffle? Game na? Sorry,
Game,
maingay po
game
yung mga
na.
aso ng kapitbahay.
Game na.
Ayan. Okay. So, share ko ulit ang aking raffle.
Doc, ano pala yung price?
Ay, okay. Hindi ko na-mention. Ayan. So, ang ating magbibigay po kami ng Bravecto na spot on para po dun sa mga 10 mananalo. And bibigyan na rin natin ng ilan bang contestants natin. Sige po, tingnan natin. So we have here 14 entries. Nakikita nyo na po ba yung mga pangalan nyo? Hindi po ba ako naisama?
Please check your name. Sige kayo.
We will have 10 winners of Bravecto Spot On. And then, hopefully po nakapag-register po kayo dahil hingin ko kay Doc Ian yung mga numbers nyo. And kukontakin ko na lang po kayo kung paano ko maipapadala sa inyo yung inyong prizes. Yan. So game na po, pwede na tayo mag-raffle ng 10.
Yes po, game na.
Okay.
So our first winner is...
Nakakaba naman.
Ayan. Si Doc Maria Teresa Quintero.
Congratulations.
Okay, so i-remove ko na yung name niya. Ayan. Okay, so next winner is si Dr. Miguel Angel Ponso. Okay, congratulations. And our third winner is si Doc Carmela. Congratulations, Doc Carmela. And our fourth winner Dr. Rogelio Peñaflor.
Congrats, Doc Rod.
Yan, konti na lang. Our fifth winner. Dr. Jefferson Rabago. Nakahabol. Parang medyo palate ko na siya na idagdag kanina. And our sixth winner, 1, 2, 3, 4, 5, tama, 6 na. Si Doc Patty.
Doc Pat.
Okay, congratulations. Yan, last 3. And our seventh winner is humabol. Siya yung pinaka-last kong dinagdag. Doc Pedro Christopher Fernandez.
Doc Tupay.
El Nido.
Yes, from El Nido.
Yan. Number 8. Francesca Cyril Calderon. Okay. And our ninth winner, konti na lang sila. Si Doc Lisa. Malapit natin pagdadalan ko kay Doc Lisa. And our last winner for tonight,
Me.
okay, congratulations.
Yay!
Winners ng Bravecto Spot On. Okay. So that's it po dun sa aking raffle. Thank you.
Yeah, thank you very much, Doc Poan. Yay, nanalo din ako.
Doc, i-announce lang yung yung post-meeting evaluation, yung link ay nasa sa chat.
Sa chat box. Okay,
Yung gusto
please look at your chat box po para sa post, ano ngayon, Doc?
Post-meeting evaluation para sa
Post-meeting evaluation.
Oo.
Yes, so maraming salamat po sa lahat ng nag-attend. Alam ko busy kayo kasi 6 p.m. na. Although galing sa office, pagod kayo galing sa office, then magpe-prepare pa ng dinner. Still, nakasama namin kayo ngayong gabi. So maraming salamat po kay Doc Bianca, kay Doc Poan, and kay Doc Lani for being with us tonight. And please don't forget, next week po sa ating 12th episode ng Dalubhayop Tech Talk. So interesting pa rin po yung topic natin next week. So we have anesthetics with Doc Guillermo Sialsipa. So paalam na tayo, Kuya Ayan. So see you next Tuesday.
Thank you.
For another Tech Talk. So thank you very much. Good night. Stay safe. Ingat po kayo palagi Ingat po, and thank you very much. Have a safe night. Enjoy your dinner.
Ay, wala
Thank you po. Stay safe sa lahat.
Thank you, Doc.
Thank you.
Thank you.
Bye, Doc.
Ingat po.
Bye.
Carla, walang picture pa.
Yes.
Picture,
Oo,
picture.
wala mo na pala magli-leave. Sorry. Picture muna, picture.
Sige.
Kaya yan, ikaw na mag-picture kasi hindi ako marunong sa ganun. Say cheese. Ay, mag-ano ka. Okay.
1, 2, 3, 4. Si Doc Nick. Isa pa.
Okay.
Wala bang ganun?
Okay.
So, okay na?
Okay na.
Okay na, Kuya Ayan? Yes, thank you very much po.
Thank you
Thank you,
po.
Doc Bianca, Doc
Thank you.
Toan,
Thank you sa mga
Doc
speakers natin.
Lailani, Doc Lani, Doc Tupay, thank you. Yan. Layo pa from El Nido. Doc Pat, Doc Migs, Doc Resty. Ay, hindi sa isa. Thank you po.
Shalom, shalom.
Yes, God bless po. Ingat palagi ah.